In this edition of Ask the Doc, I got a question from Josh on YouTube, who has been dealing with shoulder pain for 2 years caused by a frozen shoulder. Expect to learn what exactly is a frozen shoulder, common causes of frozen shoulder, if manipulation under anesthesia is a good idea, and how do I treat this issue in my clinic without injections or drugs. For those of you that don't know me, my name is Dr. Matt Maggio. I am a soft tissue injury treatment expert, specifically for neck, shoulder, sciatica, and hip pain. My focus is on diagnosing and treating adhesion, also known as scar tissue, and reducing inflammation from chronic injuries without the use of drugs, injections, or surgeries, which does lead to a significant increase in overall functioning, flexibility, and long lasting pain relief. So I'm back at it for Ask the Doc. Just a reminder, if you do have a neck, shoulder, sciatica, or hip issue, and you're struggling to get some real answers as to what is going on, you can submit your questions directly to me. And if my insights can help, I'll be sure to get a video out to you. This week's question came from Josh on YouTube. The question was, I am 34 years old and was diagnosed 2 years ago with a frozen shoulder. I did more than 6 different rounds of PT. I've had every type of advanced imaging there is, been on 3 rounds of anti-inflammatories, and had 4 cortisone shots. I had recently looked into manipulation under anesthesia and currently considering that as an option as well, but it does seem pretty intense. Everyone I have been to has been perplexed as to what is going on, and I've gotten zero pain relief and can barely lift my arm anymore. Any ideas as to what is going on and if I should try the manipulation stuff? Thanks for sending that question in, Josh, and sorry to hear you're dealing with all this, but let's get right into it. So, what exactly is a frozen shoulder? It honestly doesn't tell us a lot. We always want to have what's called a tissue specific diagnosis, exactly what the problem is, because if we don't know where the problem is and what it is, we can't hope to ever be able to fix it. So, a lot of times when people just have limited mobility in their shoulder, a lot of times it gets diagnosed as frozen shoulder, but that doesn't really tell us the whole story about what's going on. There's some type of issue in there, but just says, hey, there's a problem with the shoulder. There's a lot of structures, a lot of muscles, a lot of tendons, a lot of ligaments involved. We need to know exactly where that problem is so we can hope to fix it effectively without it getting progressively worse. Some common causes of a frozen shoulder clinical presentation. One is just going to be injury and trauma. Sometimes say you fell, maybe you played a collision sport, you had a car accident, things like that. You fall on the shoulder, you damage it. It kind of throws off the alignment of the shoulder and how things work. Ligaments don't work correctly. That in turn puts more wear and tear on the muscles, on the tendon, on the joint itself. And then eventually it puts more wear and tear on the capsule itself, which actually causes the shoulder to not be able to move. The more common cause of this is actually this stuff called adhesion. I talk about it's like scar tissue. It builds up in all the muscles around the rotator cuff, specifically in the infraspinatus, in the teres minor, supraspinatus, and the subscapularis. Their job is to help move and support and generate force in the shoulder. And a lot of times they develop this adhesion like glue from bad posture, from overuse, sitting too much, injuries, trauma, all sorts of things, periods of inactivity, and the muscle can't stretch and contract how it's supposed to. So it ends up putting more pressure somewhere else. And a lot of times it goes to that joint and that ligament in there, which is actually the shoulder capsule and causes a lot of issues in there. Now, I've seen this a lot over the years, this idea of called manipulation under anesthesia. So basically what happens is they just want to try to force that shoulder to move through that range of motion and try to break up some of those adhesions, because a lot of times if you start to move it when you're awake, it can be really painful. So they put you basically to sleep and move you through there and try to break down those adhesions. It's pretty barbaric. And good thing that you're asleep, but when you wake up, man, you might have a lot of that mobility in there, but you really put a lot of wear and tear on that shoulder. It's getting to the effect of what's going on. The capsule's getting beat up, but it's not getting to the cause. So if they go in there and they remove the adhesions from the capsule, but they never address the other underlying tissue, in the rotator cuff and the surrounding muscles, it's going to come right back and it puts you in a really bad spot. I would definitely use this as a totally last resort. And a lot of times I wouldn't even want to use it at all because I think the harm is way more than the actual positive effect you'll get from it. I would actually start with a more conservative approach where we go in and clean up all the muscles around the rotator cuff, in the infraspinatus, in the subscap, in the nerves around the shoulder, everything like that, break that down, get those moving better. And then we can go in and treat the capsule. If the capsule can't come around to conservative manual therapy, where you're actually awake, then maybe the manipulation under anesthesia would be a viable option, but I would definitely not start with it. So, how would I treat this in my own clinic? First thing I want to talk about, and I say this all the time, getting injections in the shoulder isn't actually doing anything to fix the problem. It's actually making it a lot worse. Yeah, it might temporarily reduce some pain and you might feel like you're better, but it didn't actually fix anything. Any treatment that only improves symptoms but doesn't improve function is actually dangerous. So we'd get in there and we'd clean up all the muscles around the rotator cuff. Then I'd be able to get in there very precise and very focused on the shoulder capsule itself and really break down all the adhesion in there in a safe and effective way without putting you to sleep, without torturing you like crazy. So what I want to link up in the video first is a demonstration of me treating the shoulder capsule to help break down some of that frozen shoulder buildup that's in there. So I'll link that up right now. I'm going to get my depth by leaning in with my body. I'm not going to back out. And then I'm going to set that tension just like that. And the first step is we're going to bring this arm back just like this. And you'll feel that pull right away. And we want to get this motion first. Then we'll slowly drop it in. And we're going to hold that for a 5 to 6 count. So you're in here, you're over top, and sometimes if you're having trouble getting some of that depth, you can lean over with your body. That helps you get in there a little deeper, and then you can set your tension just like that. Bring that back nice and slow. We're not in a rush here. As we bring that back, see how that comes back further? And once you get some of that motion, you can slowly drop it with this other one, and our tension is going to be leaning with that body. And when it's really bad, at the end here, I will lean on that for about 5 or 6 seconds. So a couple take homes with the video, you can see how precise and slow and focused I am. A lot of my clients and my patients describe the treatment as like a hurts but good. It should never be excruciating. If you're getting an excruciating treatment, all they're really doing is just damaging the tissue and making it a lot worse. You think in the short term, because it hurts, it must be doing something good. That's not the case. And a lot of times they're not getting an effective treatment. Once we clean up all the muscles in the rotator cuff, in the capsule as well, getting rid of all that adhesion, then we actually want to do a lot of work in the mid-back and what's called the thoracic spine. So the thoracic spine is very important in overall shoulder stability and function. And it really gets beat up because we spend so much of our lives kind of looking down and leaning forward, puts a lot of wear and tear on the thoracic spine and the ligaments in there and the muscles, and they just develop a ton of that adhesion. So we also need to go in there and clean up all that muscles in there and get that functioning, flexing better, moving better, to really allow some more support as well, because the shoulder and the thoracic spine kind of work hand in hand. Then once we clean up all the tissue, get it functioning better, moving better, we need to start to build up some strength. We do that with a corrective exercise approach where we build up some muscles in the rotator cuff, then we build up the mid back. But if we try to build up the strength in those tissues before we actually fix the problem and make the tissue healthy, that'd be like trying to fix a cavity by brushing and flossing. It's actually going to make it worse. So you got to get the tissue cleaned up first, then build up the strength. So that's all I got for you in the video. If you've been dealing with pain from a frozen shoulder for at least 6 months, you've seen way too many providers, and you're still having issues, then reach out directly to us to set up an injury consultation to get some real answers as to what is going on, and just get on the path to long-lasting pain relief so you can stay the hell away from pain pills, injections, and surgeries, which only make things worse. All the information to request a consultation is in our profile or wherever you might be consuming this video. I appreciate you watching, and we'll see you on the next one. Bye.